Good morning. I'm Jessica Okosun, and I'm a professor at Barts Cancer Institute, and I'm also a scientific advisor for the Follicular Lymphoma Foundation, and I'm here at ASH this year in Orlando. And I want to give you some of the highlights of the follicular lymphoma abstracts and presentations here today. So I'll start off with some clinical abstracts, looking particularly at new therapies. So one of the exciting abstracts, particularly for our field, is the reporting of a clinical trial looking at a bispecific called epcoritamab combined with drugs that are already approved called R-squared, that's rituximab and lenalidomide. So this was a study called an EPCOR trial, and this was a randomized trial where they compared this new combination, what they call a triplet combination, 3 drugs, epcoritamab, rituximab, and lenalidomide, and it was compared against the standard what they call the doublet combination, R-squared, rituximab, and lenalidomide. And this was in patients whose lymphomas have already returned. So this is relapsed follicular lymphoma. So what this trial showed was that the triplet combination had really excellent responses. So in patients that received this therapy, so this was over 400 patients that were randomized between these 2 different arms. In the patients that had the triplet combination, the median progression-free survival, and what that means is that how long they are free of the disease, that was not reached. So, and that is compared to R-squared, where the median progression for survival was probably about 11 months or so. So what that means is that patients that received R-squared, roughly on average, their disease would return about 11 months. But this was not the case with the triplet combination. So this is very exciting. This combination is, has just been published in the Lancet, and that was published yesterday. But also, this triplet combination has been FDA approved in the US. And so what that means is that that triplet combination will now be available for patients in the US for relapse refractory follicular lymphoma that has returned after 1 prior line of therapy. In this session also, we saw a number of different presentations focused on bispecific antibodies, not just epcoritamab. There are a number of different bispecific antibodies. One is called mosunetuzumab that was also presented at ASH this year. And I think if I were trying to summarize the different presentations, what we can see is that bispecifics are very active drugs for patients with follicular lymphoma. I think this is very exciting. We are seeing trials evaluating these different bispecifics either on their own or in combination. They're being evaluated as first-line treatment or upfront treatment for patients, but we're also evaluating them when the diseases come back. And they look very effective in each of these different scenarios. One of the things I would say is that as we are excited by new therapies that are efficacious, we also have to think about safety for patients, so making sure that these are not too toxic for patients. And we do know that these bispecific antibodies are associated with perhaps an increased risk of infections. I think that's something that we have to keep an eye out for in the future. I think one of the other important things, and I think it's a good problem to have, is that the more therapies we have for patients, the more that it becomes a little bit difficult to choose. And we come to this whole challenge also of what is the right choice in terms of order of treatment. Which one should we give patients first? So we want to give them the most effective treatment first. And then when the disease does come back, we want to make sure we're giving them the most effective treatment, but also as safe as possible. So these are the challenges that we are going to have to deal with in the community. And I hope we'll get the answers as we learn more. I think the also really important thing, in addition to looking at new drugs, is there were some really nice abstracts looking at the biology of follicular lymphoma. I think it is really important as we develop new drugs that we also continue to probe the biology of follicular lymphoma. This is particularly important. We still don't have the answers of why patients' follicular lymphoma returns, and we need to try and understand why that is. There was a really nice abstract that was presented by Karen Tart from France, and this was looking at patients with follicular lymphoma and looking at their disease, studying the biology of their disease at the beginning and then later when their disease came back. And what they were trying to hone in on was they was trying to understand, are they leftover lymphoma cells after they received the first treatment? and to try and understand the characteristics, the features, what's unique about these sort of leftover cells. Because if we understand the biology of that, we may find ways to target that and hopefully eradicate and reduce the risk of the lymphomas coming back. So I'm very excited by the increased understanding of the biology of follicular lymphoma. We need that alongside the development of new therapies also. So overall, I think a very important and exciting ASH in terms of developments, both on the clinical side for follicular lymphoma, but also on the biological side.